Yeah, beautiful people. It's me, Frank Donga, your number one job seeker, and this is Hello Doc with Frank Donga. On this show, we'll be bringing you some undiluted hot gists. This time of the day, I know you like gist just like me. This one you hear today is will shock you. I promise you. This is the kind of gist that will affect your health and that of your family. Yes, everybody needs to join. We are talking about health matters on this podcast, on this show. Anything you are seeing or hearing about health. I'm not alone. There's an Obonge health expert here with me. Together, we're going to be dropping the gist on you. Wow! Just like that. As the hot, Neil are the ones powering this gist. So whatever you are doing, wherever you are, at home, at work, at play, at sleep, eyes open. Call your best friend. Follow me. Let's go and gist the gist together. I'll be back. I'll come. You see, growing up in Africa, you realize that a child does well in school, and then people say, that's this child, that's the son or the daughter of her father or his father. The father, Sha. If the child is not doing well, you go and fail. You say, Nai mama bonam, siam. My own question is, where was the daddy when that child started to fail small? Hey, the father traveled. What? Now, so we see, a lot of men are breadwinners of their family, without a doubt. They're providing money, protection, support. But if you ask some fathers, what school your pikin, your child, they attend? Nagobe, no answer. You cannot remember. Even tell some of them, say, is your child in primary 1 or primary 2? No idea. You just know his child is in school. Some will not even know what vaccination the child has taken. Has your child been immunized against polio? I don't know. Ask his mother. Has he been immunized against it? Some of you that are even listening to me, what vaccine has your child taken? You that are listening to me, you are watching me and listening to my voice. Which vaccine has your baby taken? The last one. Can you tell me the last one? Baba, no, they look elsewhere. Hear me now, Baba. No, they look, answer the question. Okay, as a man, can you follow your pregnant wife to the hospital or the health center for prenatal or antenatal or postnatal or postdoctoral, postgraduate, whatever checkup? You follow them. If not, why not? If yes, why yes? Can you carry your baby to a health center for immunization by yourself if your wife travels? If not, why not? If yes, why yes? My guest on today's show is no other person but Dr. Francis Ohayindo. Dr. Ohayindo is a physician, he's a social entrepreneur, and a poet. He advocates for transformative African leadership, in case you don't know. He's currently the president of the West African Academy of Public Health.
Hello, Doc. With Frank Donga. Hello, Doc.
You're listening to Hello Doc with Frank Donga.
All right, you're welcome to the show, Doctor.
Thank you very much. It's a pleasure to be here again.
Good to have you. You know, always, this is your style, always the bamboo finish. See as you combine the color again. Light cream on top, brown, the black, a touch of
Frank,
black. Even your watch, when they match your...
Frank, you're shaking one table somewhere. Please, I beg, take it easy.
Well, let me face my friend. Let me face my front too. So, Doctor, first of all, you are a public health expert.
Yeah.
Why is it that most messages about health are always targeted at women when it comes to child health, child immunization? They say, Mama Nkechi, carry your pikin, go immunization. Auntie Sandra, well, whenever they hear you target me, why?
Okay, well, let me first start by saying it's actually wrong. Most societies are patriarchal. What it just means is that it's a society that men are considered heads of households, and then certain tasks in the household is seen to be allocated to the woman, which includes who takes care of the child day-to-day basis. The man can go to the farm, do that. The woman can go to the farm, but most times it's like the man is seen to be the one who is out there while the woman is the one who is here with the children. Whatever it is, the dynamics that play out in those households is at the end of the day, it's the mother that is the first point. So originally, in planning programs, people just felt, oh, who is likely to be the person, the caregiver of this child? It's not likely to be the man, because of that social structure. So most times the tendency is to target the men with messages around that. Instead of routine immunization, the target has always tended to be the woman with those messages. And people forget that men have to be partners in this thing because, one, they are decision makers in that setting. Let's accept that setting exists. We cannot pretend it's not there. That is a structure that most of our societies like. So they are decision makers, but they have to be carried along. Their level of health literacy can determine the fortune of their family. Fortune, literally, both in terms of the outcome for the child, the wife, and even their household wealth because of simple decisions. I'll give you an example. If, for example, a child is not immunized and comes down with measles, and the child, for example, becomes very sick, and measles has a tendency to even throw the child into frank malnutrition. And possibly they didn't know what it was. The child's belly now, because of the malnutrition, what you see, kwashiorkor. The child becomes skinny and ends up with big tummy, and people are telling him that he's the father, that is some people, some ancestors or something that are affecting the child.
They say whether they don't.
Yes, that's why he has big belly.
They say that
that they
people.
put something there, you know, and all that. And the guy uses that to base his decision. And the child dies. Or the child even gets even more sick. Or the outcomes of the child become very dicey. They now have to go and borrow money. Let's say they are poor family. Because the man is not bringing money all the time. So in order to pay back that money, it means they will become impoverished. If they were here, they will be somewhere down here. That is why sometimes that immunization factor is very important, because you don't know how far the child's sickness window will carry the child. It can throw a family's economy into shambles.
So, I mean, you have said it that, you know, sometimes this messaging, even though it is wrong, but it's targeted most times at women, because women are perceived to be the ones in direct contact with the children. But, you know, as a doctor, I'm sure in your years of experience, you've seen some of these men at the community health level, public health campaigns. Why is it that men find it difficult, you know, to participate in the immunization of their children? Is there any particular reason you found?
I think a large chunk of it, like I mentioned, social ideas and ideograms that push, that are drivers of this. And a major one is the fact that they have seen it like a social norm, that this is a woman's affair, to carry the child to the hospital. And the problem with that is that it is both their affair, the man and the woman. But because they see their gender norm roles that have been so perpetuated over time, they forget that their role, their being there is important. And it slows down decision making, because they are mostly in this role, the decision makers. So if the man is not there, the woman does not go anywhere, because one, she may not have the money. It may have to come from the man. So you see, a child that has 30 minutes window to be able to access health, to be able to have a better, to be stabilized for a better outcome, may not have that window, because they are waiting for the father to come and even first agree that they will go to the hospital, and then agree that he will bring out money. You see where there's a problem. So when you add all those things in that, so you see why messaging is important, and why his capacity to understand health, some level of health literacy, is also important. The other issue is born out of that is perception. Because there's already that sense of gender role, the man feels uncomfortable being seen in a health facility with his wife and children, because he feels he's breaking a norm. So normative values.
Is it that he's becoming soft, or that he's woman rapper?
Think, yes, some people will call him woman rapper, without realizing that he needs to be that rapper to keep his family alive.
Wow.
So those things are important. So sometimes those perceptions. So those things create all sorts of barriers in the mind. And of course, and even some of the facility administrators or providers in health facility are not comfortable having the man in the facility.
Why?
Because of that same perception. Wrong perception. What's this man doing here? Yeah. What's he following his wife for? Some might even voice it. Because those people too need to be educated that a man has to be a partner in the management of care of his family. Whether for routine immunization or for anything, whether antenatal visits, the man has to be there.
Hello, Doc with Frank Tonga. Hello, Doc.
You're listening to Hello Doc with Frank Tonga.
If a man understands that he has to be a partner in routine immunization, the likelihood that his children will complete all the immunization will be there and complete them in time and achieve their milestones in good time too. have better outcomes in life is higher. So those things are very critical. So the man has to be a partner. And so it brings a new paradigm that we need to, in communicating, target both parents.
I'm happy that you said in communicating, we need to target both parents. So what are these practical steps that we can take?
Policy making, whether at institutional level, has to key into the fact that it has to target both parents, so that both parents are part and parcel of that overall flow within the health system. Then the other thing, we need to educate providers. A lot of times the in-service training, pre-service and in-service training of providers they are challenges with interpersonal communication. So sometimes not everything you just see, it's on provider. Say, oh, this man, what are you doing in this facility? The man will not come back to that facility. And he will just feel, was it? So they need to also be able to engage them and make them feel at home in the facility, make them know that they are part and parcel of this facility. And so long as they are there for health seeking for either them, their children, their wives, they have to be part and parcel of that management of their children and wives. So it's that kind of thing. So when we do that, then routine immunization, occasionally, if communities when we target health promotion activities and immunization programs, we need to target men, because most of the time you go to all those where they're giving them talks, is only women. So we already have a captive audience that we think should only be women. We should have an audience that should be a mixed group, so that everybody in the community is part and parcel of it. That's how you can build community health literacy. If everybody is part and parcel of this thing, because you may end up having the woman understand the issues, and the man does not, and when they get home, it becomes a problem.
Wahala.
Because she is now saying, from the point of, I've been
Very
told
correct.
This is right, this is what should be done. But the man does not understand. So he fights her because he feels this woman is coming up with new ideas, that resistance to change. Even like our Nollywood and in other countries, whether Gollywood and all that, they need to also, we need to engage them to make sure that they don't perpetuate some of those issues in their movies. Because people also see movies as a way of creating norms in the society. And what you put across there is very important. So we should not perpetuate some of these things. We should also try to, that's what Hollywood, when Hollywood was Hollywood, tried to do. Create the American dream for Americans. And so we need, as Africans, also begin to look at some of those media as means of redefining the things that we are getting wrong.
I agree with you.
In communities where the men are very busy, in, let's say, farming community where they're very busy and their tendency to their farming period is more in the morning, they can design these programs when they have these talks, when they have this immunization schedule, especially where they're doing a national program like that. They tie it to a window where those people are back from those farms. The foundation of our healthcare system is primary healthcare. And primary healthcare is supposed to be at the bottom of the social pyramid where people are. 70% of the diseases that we deal with in Africa are mostly infectious diseases. And most of them can be treated at primary healthcare level.
70% of the diseases
now.
now
Of these are mostly
infectious.
Diseases you can treat at primary healthcare level. A large chunk of them, whether most cases malaria, diarrhea diseases, and respiratory tract infections. Most of them are infectious diseases. So that if we get primary health care right, with routine immunization as a major driver within primary health care, we can deal away with most of the problems on this end. And I think in one of the last episode we discussed, I mentioned that the Asian tigers were able to get these things right, because they work towards what you call universal health coverage, make sure that nobody's left behind. We should be able to do that same thing with immunization, make sure that primary healthcare system is working, so that even Obasanjo can walk out of Water Farm, walk 10 minutes and get treated for malaria in the primary healthcare center. Because that is the way we need to, that's the model we need to get. It is not about highfalutin ideas about what a hospital should be, but service at that level, because those things are just basic things that you need to do to get, and a lot of them are around immunization, a lot of them are just basic treatments. You will get it right. It's when they become complicated, you move the person or the patient up the chain, whether to secondary level or tertiary level. But the problem here, we invest almost 70% of our resources at tertiary level and forget primary healthcare. And the thing in immunization, the major driver should be primary healthcare.
Thank you very much, Doctor.
Yeah, you're welcome.
It's always a pleasure having you on the show.
Thank you very much.
Now, you've heard it all, though. Dr. Francis has said it again. All the things about immunization and the role of fathers in routine immunization. If you are one of those fathers that they have to wait for you to make decision whether they will carry your child to hospital for immunization, change your way. Oh, they have said it now. It's always a pleasure having you listen to us and watch us on this podcast and this video show. Hello Doc with Frank Donga. So whatever is on your mind, tweet at us, upload on social media, follow us at NIA Campaigns and use the hashtag #ChangeCreators. Hashtag #ChangeCreators. And we'll be very happy to respond to all your questions and inquiry. Thank you very much for sticking around once again. Thank you, Dr. Francis. It's always a pleasure having you. Whatever you do, don't do yourself.